computer.
Got
Great.
it. We're good now.
Hey, so I'm here with Dr. Mary O'Connor, and I've written down all of her information because I want to make sure to get it right. So Dr. Mary O'Connor is the Chief Medical Officer and co-founder of Vori Health. She is the co-author of Taking Care of You, The Empowered Woman's Guide to Better Health, and she's an orthopedic surgeon. So Mary and I met on another podcast, several months ago, and we were talking about other issues about health. Then on June 16th, and I remember you talking about osteoporosis back then, by the way. So on June 16th of this year, I had a DEXA scan a week earlier, and I get diagnosed with osteoporosis. And I come back home, and I just think to myself, okay, well, what do I do? So who do I call? So somebody told me to call an endocrinologist. So I find an endocrinologist, and turns out it's really hard to get an appointment with an endocrinologist in New York in my insurance company, that takes my insurance. So my appointment's not until December. And I thought to myself, I need to know what's going on before then. And I had talked to you, Dr. O'Connor, before, and I thought, well, I'm just going to have you on, and I'm not going to do any research, right? I'm going to be the person who just got diagnosed. Now, I would have just got diagnosed if I hadn't had my car accident. So that was June 16th. I've been in recovery ever since. And now I'm like, okay, I got to deal with this issue. So first of all, what does it mean to have osteoporosis? Let's just define our terms.
Okay. So osteoporosis is basically when our bones have become weaker.
Mm-hmm.
And the challenge here is that puts you at higher risk of a fracture. And particularly as we get older, fractures can be very devastating. Hip fractures in particular, as well as fractures in our spine that are called compression fractures. And this is very, very important for women because post-menopause, we lose bone density at a higher rate. Now, I'm going to back up a minute because this is a really important concept. When we're young and we're growing, we're building bone. We're growing taller, our bones are growing, and they're growing not just in length and circumference, but in strength.
Mm-hmm.
We reach our peak bone strength in our early 20s.
Wow.
After that, Deborah, the bad news is like downhill from there. Okay. And honestly, it's a race between, are you going to die first before your bones get so weak that you fracture? I know but that's the actual reality, unless you're really proactively engaged in maintaining your bone health.
But okay, so here's the thing. I've heard about maintaining bone health all my life. So I'm healthy. I do yoga 3 to 4 times a week. I walk every single day. I have yogurt and milk. I have all my leafy greens. I mean, I am as healthy as a person can be. Like, what else could I have been doing? And I still got osteoporosis.
So those are really good points because sometimes we're just dealt the genetic osteoporosis card. Okay.
Bad.
And there's nothing you can do about that.
Yeah.
Except stay on top of it to understand if you're developing osteoporosis, because there is a stage before osteoporosis called osteopenia. And what that means is your bones are not normal in terms of strength and density, but you're not quite osteoporotic yet. Okay. So that's the warning sign that you're headed in the wrong direction. Now, of course, what's important is that throughout our lifetimes, we work on keeping healthy bones. And the key to all of that is weight-bearing exercises.
Which are what? Tell me what a weight-bearing exercise is.
Weight-bearing exercises are running, walking is a weight-bearing exercise, lifting weights, getting in the gym, and doing resistance exercises in the gym. Okay, because bones respond to stress. So if you are exercising and putting more stress on the bones get stronger.
So
So
I could be doing more weightlifting, but wouldn't yoga be considered, because I'm doing a lot of this, that is that not the same as lifting weights?
no, no, because it's not putting as much stress on your bones as if you were running, where you're pounding on the pavement, right? You're running,
Mm-hmm.
or you're doing weights. So,
Okay.
so it's weight-bearing exercises, it's adequate calcium, which it sounds like you have in your diet,
Mm.
and adequate vitamin D. And this is where a lot of people have an opportunity to improve. Okay, so
Vitamin D. Okay.
let's talk for a minute about vitamin D because it's really, really important. Vitamin D, we call it a vitamin, but it's actually a hormone. So it has receptors in our body all over the place, including our muscle. And we know that if you give older patients in what we would used to call nursing homes,
Mhm.
right, more vitamin D and get their vitamin D levels up, they are less likely to fall. Okay. So so vitamin D is also critically important to our bone health because if you don't have adequate vitamin D, you cannot absorb the calcium that you eat. So you can be eating lots of yogurt and cheese or wherever you're getting your calcium. And if you don't have adequate vitamin D, then you will not absorb the calcium. So if
So question. I thought, I mean, again, from my reading, that if you walk out, which I've been doing every morning forever, and go on a walk in the morning without sunscreen on your face, which is what I do in the morning because it's not so high in the sky, that you're getting vitamin D through your skin. Not true?
yes, but there's always a but, isn't there?
Yeah.
So here's the deal. Vitamin D is in natural vitamin D through foods is not it's not easy to get vitamin D through foods.
Mm-hmm.
Like that's why people used to take cod liver oil. Cod liver oil, very rich in vitamin D. So you can get it through some fish and a few other foods, but it's not that common, which is why you will see milk containing vitamin D as a supplement.
Right.
Okay. So yes, you get vitamin D from the sunlight on your skin, converting the vitamin D precursor that's in the layer of fat underneath your skin to vitamin D. Okay. What's the problem with that? One, as we age, this little fatty layer underneath our skin thins.
Yeah, very much so.
Okay, thins. And so we don't have the ability to produce as much vitamin D.
Oh, that's interesting.
Number two, and more important, is that the intensity of the sunlight has to meet a certain threshold for this vitamin D precursor conversion in your skin to happen. And up north where you are, 9 months of the year, that sun is not intense enough to convert any vitamin D. So you're out there doing your walk in the morning, feeling good.
My vitamin D, but not.
Sunshine on your face, no sunscreen because that will block vitamin D convert, right? And you're not converting any D, darling. I'm sorry to tell you, but you're not converting it. Okay.
Oh my God, I've been doing it all wrong my whole life. Okay.
You could run naked through this. I have a talk about vitamin D and I show a picture of Boston. I say, you could run naked through the streets of Boston. For these months out of the year, you're not going to convert any vitamin D. So,
okay, so what do I do to get vitamin D?
it's very simple. You go to the vitamin shop. I mean, this is what I take, and you get vitamin D3. D3 is the best supplement form. And you just buy a bottle that has 1,000 international units of vitamin D. They'll come in little gel caps, so they're very easy to swallow. And you just take one a day. It's very, very hard to take too much vitamin D. Now, you should also make sure that your primary care doctor is checking your vitamin D level. And a lot of them will do that now.
So I just had a vitamin D test 2 days ago. I don't have the results of that yet, but again, he had given me the prescription the day that I got diagnosed with osteoporosis. Then I got in the car accident, all hell broke loose. So now I'm finally taking care of the old health. And I went 2 days ago to get the vitamin D, assessment, and I don't, when I get the results, we'll know more.
Yeah, but you can go do it now. I
Just
mean, everybody
go
should
start
be
using
like in my mind, every woman, particularly every white woman, okay, post-menopause should be taking vitamin D supplement. It's very, very hard to take too much vitamin D, like to get to an overdose, a dangerous range of vitamin D supplementation is really hard. And the people that I know that are like vitamin D research guru experts, they will take more than 1,000 international units a day.
Okay, so as soon as I'm done with this video and you and me, I'm going to run to the store. That's one thing I'm going to do.
Yeah.
But here are my sort of overall greater questions about all this. Why did I only find out that I had osteoporosis when I finally had osteoporosis? Like why? So, I'm 57, so I go get sent for a DEXA scan, which seems to be the normal age to do this. Why wasn't I sent for a DEXA scan at age 47? Why wasn't I sent for a DEXA scan after I got my uterus out? Why wasn't I put on MHT after I got my uterus out? I mean, I know the reason why I wasn't put on MHT because we were like bad, we were saying MHT was bad back then. So it was a generational issue, unfortunately for me. But had I been put on hormone therapy right after getting my uterus out, would I have perhaps avoided this?
Most likely, yeah. Well, you would have either avoided it or mitigated it. It wouldn't be as bad as it is now, right? Because estrogen helps protect our bones. Okay. So once we go through menopause and we lose the normal estrogen that we had pre-menopause, that accelerates the weakening of our bones, which is, and I know the debate about hormone replacement therapy post-menopause, remains active, but if you don't want to break your hip when you're 80 or 90, then certainly my advice to women who are going through menopause is have a serious conversation about whether you should be on hormone replacement therapy. And part of that should be an assessment of your risk of fracture and your bone health. In other words, did your mother break her hip? Did your grandmother break her hip? Okay. What's your DEXA scan result, meaning your bone density now? What's your lifestyle like? These are all important factors. And a hip fracture.
I haven't even heard the word DEXA scan until this year. Well, it's just, again, it seems to go back to the whole issue of women's health and how we're not serving women because people in med school were not taught this back when they were learning, or menopause in general was just not taught. And so we, Generation X, I'm 57, I mean, my mother's generations fared much worse, I think, because they were taken off their hormones in 2000 or whenever, the Women's Health Initiative came out. But we have a chance to kind of ameliorate that, I'm hoping, or at least help the women who are in their 40s right now to not get to where I am. But what is, I know that standard of care is, you get your mammogram at, I don't know what the age is these days. Like, why isn't a DEXA scan this, standard of care at this point? Why isn't that when you get your first mammogram and your first colonoscopy, why aren't we told to get a DEXA scan as well? That seems to be only logical.
Because basically the guidelines will say that when you get to a certain age, that's when the preventative guidelines recommend that you get a DEXA. And doing a DEXA on a woman in her 40s is probably not going to be that helpful.
Okay.
So it's, now that doesn't mean that women don't need to be educated about how important it is to maintain bone health throughout their lifespan, okay? And in their daughters and in their children, right? Because remember, this is about building bone strength and bone stock, you can think of it, when we're young. And like carbonated beverages, pop, soda, bad, very bad for bones. Carbonated.
What about just like Perrier or carbonated water?
That's actually a good question. I'm not sure of that answer, but
Okay.
but again, what's more important is the three things that anyone can do right now: weight-bearing exercises, adequate calcium, and adequate vitamin D. And it's a vitamin D that is such a huge opportunity, because when you look at studies, there are so many people that are low on vitamin D. And without vitamin D, you can't absorb the calcium to build strong bones.
All right, so now that I have osteoporosis, what are my options? Somebody told me about Prolia and Fomax, all these things. What would you suggest?
So if you're, first of all, at age 57, and again, I'm the orthopedic surgeon, so I deal with the fractures that you're going to avoid because you are now getting on top of this. Okay. So the frontline medications, in addition to telling you weight-bearing exercises, adequate calcium, vitamin D, are called the bisphosphonates.
Bisphosphonates, okay.
Bisphosphonates, okay. And there's several of them on the market, like Fosamax, Actonel, Beniva, okay. Many of these pills can cause heartburn, upset stomach, some things like that. There's also an infusion. You can get the medicine into your veins. You can do that. This is the frontline medical therapy. Now, I'll be a little bit controversial here.
Okay, be controversial. We love controversy here, yes.
Okay. Because here's what these medicines do. And I want your listeners to just stay with me for a second, because then you'll get it. We think of bone as being this inert substance. It's like just this material that does nothing. That is not true. Bone is living tissue. Bone is alive, okay? Bone is constantly going through a process of resorption, meaning bone is eaten away, and rebuilding, meaning bone is added. When we're young and growing, the building is greater than the resorption. When we get older, the resorption is greater than the rebuilding. That's why our bones get weaker. Okay. The bisphosphonates medications that I just listed that are the frontline medical therapy, like Fosamax, Actonel, Beniva, block resorption of bone. They work in terms of the way the drug works is it helps block the resorption of the bone so the bone doesn't get as weak. Okay. One of the challenges with that is that in some cases, it's not common. Think of the bone as almost getting frozen. It's like you've uncoupled the resorption and the rebuilding, and the bone becomes more inert, so to speak. And when people and they can fracture, and then those fractures are difficult to get to heal. So when patients are put on these bisphosphonate medications, it will be recommended frequently that after a certain number of years, they have a drug holiday. So go off the medicine to give your bone
Chance to rebuild.
a chance to go back to a more normal cycle. Now, there are other medications that work on stimulating the formation of bone. Okay. And so they work the exact opposite. Instead of saying, okay, we're going to keep your bones stronger by blocking the resorption, we're going to keep your bones stronger by stimulating more formation of bone. Okay, now intellectually, to me, that makes so much more sense.
Yeah.
Okay. And so if I needed to be put on a medication for osteoporosis right now, I would be having the conversation like, why should I go on this medication that's going to block the resorption? Why shouldn't you put me on a medication that's going to stimulate the building of bone?
And what are those drugs called?
Well, those drugs are called, you can think of it like bone building drugs. And one of the most common ones is Forteo. I'm giving you the common term, right? And those are considered second line drugs. Probably because they're more expensive.
Mm.
And hence the, a recommend, and the other drugs work too. Like the drugs that block the resorption of bone, they work. They have been shown to decrease the risk of fracture. So that's why I'm being controversial, because if it was like, I want my bone stronger because I want it building more bone. That to me is biologically more favorable than blocking the resorption of the bone.
Okay, so if you were given a diagnosis of osteoporosis today, you would be talking, well, that's the other thing. Which doctor do I go see? Is an endocrinologist the correct doctor? That's like, essentially, a lot of times we're given diagnosis and we're like, have fun, like, go figure this out, and
Well, this
oftentimes I'm
is
like, well, even here, I'll give you a perfect example. I had this giant hematoma on my chin from the
accident.
accident, and it was leaking into my mouth, but also like right there on the skin. So I was like, do I go see a dermatologist and get it cut out this way? Or do I go to an ENT and get it sewed up that way? It was just, sometimes we don't know which part of our body to find the expert in. So if you were to this is the question I have for you. If you were to be given a diagnosis of osteoporosis today, what would you, Dr. Mary O'Connor, an orthopedic surgeon, do?
I would go to the endocrinologist because I would be pleading my case for the bone building drug.
Okay.
That's why. And if I went to my primary care doctor would almost certainly recommend the frontline bisphosphonate medications that block the resorption of bone, because those are what the guidelines call for.
Okay.
Okay.
I'm going to go see the endocrinologist in December. Is that too late? I don't know how long I've had osteoporosis. Like, between June and December, that's when I made the appointment. Like 6 months, is that a normal time to wait? Should I be, I will run down the street after we get off of here and go start taking my vitamin D. But, again, 6 months?
Well, that's the issue of access because of your insurance, right? Your insurance says, here's the limited panel of specialists that will cover.
Yeah.
So I squarely put that on responsibility on the insurance carrier that is not providing you with better access to specialty care.
Fidelis.
I'm just saying,
Yeah.
right? You shouldn't have to wait that long to see a specialist.
Especially in New York City, where I should be able to see somebody quickly, but I can't. There's just not a lot of people. I called, I don't know how many people I called, but this was the first appointment I could make.
Well,
December.
there's a lot of people, but there's not a lot of people that your insurance covers.
I know.
That's the issue, right? So, but I want to emphasize that for people that are watching and listening, like the bisphosphonates are still very effective.
Okay.
You just have to, again, that's my personal bias because I've taken care of, unfortunately, hundreds of patients that have broken their hip. And a little over a year ago, my mother broke her hip. And that was, and 20% of people that break their hips are dead within the first year. So it is like the straw that broke the camel's back, right? It's the older patient, typically older woman. Grandma falls and breaks her hip, and then it just starts this spiral cascade downward and resulting in that person passing within a year. 20% of patients die within the first year of a hip fracture. It's huge.
And how are they breaking their hips? Just by walking, by nothing? Just the hip just breaks?
So typically the hip breaks and then they fall is actually what usually happens. In my mom's case, she sat down on the kitchen chair and she didn't sit down squarely.
Oh.
And she literally slid off the chair, which is what, like a foot and a half, 2 feet off the floor, and broke her hip.
Oh. Is she okay?
Yeah. Yes, we got her through that. There's other challenges with 94-year-old mother, God bless her, we're taking care of her at home, but she's gotten through the hip fracture. But it's just it's so disruptive. It's been so disruptive for her and very challenging for the children, right?
Yeah.
So it's like, if you want to have quality of life and independence as an older adult, you absolutely must pay attention to your bone health.
Okay. Well, I have neglected it, or I thought I was taking care of my bone health, but I didn't know all the details. I didn't know about vitamin D. I was just not educated, which is why I wanted to talk to you today to spread the gospel at this point.
And Deborah, let me make one more comment. We think of osteoporosis as a woman's disease because it affects women more predominantly. Okay.
Because of
If you
estrogen
look at
loss.
populations, but we're not alone in this.
Right.
Men get osteoporosis as well. Men tend to break their hip 10 years after at an age that's 10 years older than the typical woman.
Mm-hmm.
So everybody in the family needs to be paying attention to bone health, not just the women, but it affects us at an earlier age. We lose our bone density faster. So we're at the fracture threshold risk at a younger age, in our 70s and 80s, where men will enter that fracture risk threshold in their 80s and 90s. And men also typically start off with a higher bone density strength as a young adult than a young woman, a girl, which
Mm-hmm.
is another reason why sports for girls so important, right?
Right.
Sports helps them in so many ways, but in terms of their bone health, that's helping them build strong bones in that early phase of their life when you're building your peak bone mass.
Okay, that's a
So
really good thing to know. So actually, it's too late for me, but I have a daughter who's 26. She's in
then
med school.
she should be doing weight-bearing exercises.
Yeah,
She should be taking her vitamin D because she's,
she's
so
my daughter. Yeah.
many people, right? And making sure she's getting adequate calcium.
Okay. She does the adequate calcium, and she joined a gym, so she's doing that gym stuff. But the vitamin D, I think I'll just send her a giant bottle and say, start taking this now.
It's so easy. I mean, I tell everybody, 1,000 international units a day. Just go get the little gel cap, just take it.
Okay. Well, that's good to know now. Um, I don't have any other pressing questions. I think you've answered everything. If there's anything that you think I've left out that you want to say about osteoporosis and bone health, be my guest. But I'm just feeling kind of awful about all this, that I just didn't know, wasn't taking care of myself, and suddenly here I am with osteoporosis. Like, I guess, all right, here I do have one question. What age do you suggest that women go get a DEXA scan?
There are established guidelines, so I don't want to give you the wrong age.
Right.
And the guidelines vary based on some individual patient characteristics. For example, have you had a hysterectomy at a younger age? Okay.
Check.
Right. So the age guideline will vary, but I'll close with this comment that I think is really important for us to remember. Osteoporosis is the silent killer. Osteoporosis is the silent killer, because what happens is we break bones, and the consequences of those fractures start us in that downward death spiral. So it's just so important okay, we're all going to go someday, but what we want to do is have high quality of life up until the end. And that means not breaking your hip and not getting compression fractures in your spine, which cause chronic pain.
My sister has that. She's the orthopedic surgeon, and she's just been leaning over doing surgery, and now she has 4 screws in her neck from 3 spinal surgeries.
Well,
yeah. So it's our genetics, I guess,
That is definitely almost certainly a factor in your situation, which is why that family history is so important, right? Because your risk is going to be higher than somebody else's.
Right. So I can help my daughter have better bone health. It's too late for me, but I can help my daughter. Or I
But
can, not too late for me, but I'm going to take that vitamin D. I'm going to go see that endocrinologist. I'll see what I can do. But I'm feeling a little hopeless about all this.
no, you can improve your bone health on these medications.
Okay.
They can do that.
Okay.
Okay. So I don't want you to feel helpless, because you're not in a helpless situation. You're actually in the situation where now you are motivated and empowered because you know you have the issue to address the issue. And thank God you had the DEXA scan,
I know.
because otherwise you could have gone who knows how long, right? And this just gotten worse and worse. So no, you just need medication, exercise, vitamin D, calcium,
And some weights. I'm going to
and
get some weights. Yeah.
follow up DEXA scans to monitor how you're responding to the medication.
Right. That's what I've got to do as well. All right. These are all amazing pieces of advice. I really appreciate that you took the time out of your busy day to talk to me today. I'll write this up next week. Meanwhile, I'm going to press stop on the recording.
Okay.
Second, stop recording.